Hello everyone. So we're just going to talk briefly about some of the urinalysis that we can do here at Western Hospital and everywhere. So the first thing I'm going to talk about is standard urinalysis. And urinalysis is essentially using a dipstick to check for the contents of certain substances inside the urine to help diagnose patients. So these standard dipsticks, these multi-sticks, we can actually test the urine, see if it's got leukocytes, nitrites, proteins, the pH, blood, ketones, glucose, all sorts of different things. But there is a procedure to follow to make sure that it's a valid test. You might find that patients will bring in urine in all walks of life. So if you're in the GP practice, they might bring it in jam jars or sandwich bags or proper specimen pots. You might ask them to go and pass some urine. And in hospital, the urine can be collected by any member of staff in any kind of clean receptacle. Important things to think about before you go and collect the urine: you shouldn't test any urine that's more than 2 hours old. And if you are going to be doing anything around urine, I hope that you would always wear gloves when performing any kind of test. So, if we are going to perform a test of this urine, the first thing we need to do is make sure that we look at the urinalysis sticks, and we look at the pot to make sure it's clean, dry and intact. And we also look at the expiry date to make sure they are in date. And miracles upon miracles, this actual pot is in date. We then want to open it up, and one thing that we want to check for is that the urinalysis sticks that are in there are all the correct way up. Because if they're upside down, that means they might have been taken out and put back in again. We also need to make sure that it's dry in there. So select your urine dip stick, and you'll notice that it's got all these coloured pads on the side. And what we need to do is submerge that into the urine and then tap it on the side to make sure we get rid of the excess. And then we're going to compare the colour change on the side of the pot. You'll notice that on the side of the pot there is a number below each test. That is the amount of seconds you have to wait for before you actually take the final colour. So if I select my first pot of urine, now I don't want you to be alarmed. It is not urine, but you can get 10 points if you email in with what you think the substance is, and if you are correct you get 10 points. So I'm going to dip my stick into the urine, and then I'm going to tap it on the side just to make sure I get rid of the excess. I'm then going to make sure I've got a clock that I can see, and I'm then going to start checking the colours to see if there is a colour change. It's important to make sure you don't let the urine dipstick touch the side of the pot, because we don't want to make that dirty for other people to touch. And 30 seconds has gone by, so we just can start comparing those colours. And as we work through, we can start comparing things just to see if we can make sure where the colour is. Depending on the results, we can then use that to help diagnose our patient as part of a complete assessment of the patient. So the urine dipstick isn't necessarily a thing on its own to be able to diagnose a patient. It's done in conjunction with other tests and examinations. In the hospital, you might find, even in your GP practice, that there are actually machines that you can then rest the stick in, and these machines will then analyse the stick for you, but they're not available everywhere, so it's important to be able to know how to do the skill manually. Okay. Another test that we can do is pregnancy testing. We do have some pregnancy testing kits in the skills lab. They are always probably out of date, so before you think about popping in to use one, do consider that fact. Pregnancy testing kits are sometimes a bit complicated, or just to be able to make sure you do get it right, it's important to make sure that you use some instructions to be able to follow what you need to do. Now these instructions are really helpful. They tell you what you're meant to be doing with this stick, and with this stick what it wants you to do is be able to insert the stick so the level of the liquid is level with this blue portion of the stick, and then you want to hold it into the urine for 10 seconds, and then we want to wait to see if we get any results. And what you're looking for are some lines to appear on this part of the stick. So we're going to dip this now, hold it for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then we're going to take it out, just give it a little tap, and then we're going to leave it to see if we get any results. As we can see on our instructions, we can see that a negative result is an upper line, a positive result is 2 lines, another positive result is an upper line and a very faint lower line, an invalid response is a lower line on its own, and another invalid response is nothing happening at all. So that's important that you have this so you know exactly what you're saying. Another test that's performed very rarely, and not in this trust, but it can be performed, is a bedside drugs of misuse testing. And you'll often get like a little kit like this, and it will give you instructions of what to do with the little kit. So they come with a very convenient little pipette, and what they want you to do is take a pipette full of urine and just put 3 drips in each pot and allow that test to work. Okay. And then, as you can see, the test fills up. It looks for the liquid will go up the paper on the actual test, and it will put little lines across where there are indicators that there are. So when there is a little line, that is an indicator that that is a negative test. If there is a line missing next to a word, then that is an indication that is a positive test. You always have to have a line in the top here, that is the control line. If there is no lines on the control line, then it's an invalid test. It always needs to make sure that there is a line missing from the actual thing. So we're looking for amphetamines, cocaine, all those different kinds of things. And hopefully this will be a completely negative test. So yeah, so we can see there, so we've got none of those, benzos, TCA, methamphetamine, oh lovely, okay, we haven't got any of those, MDMA, no test, so this substance that we have is completely negative. Right, so that's taking our urinalysis bedside tests. We'll put some resources online so you can see what the tests actually mean, and thank you very much.